Hi, Brian.
Hello, how are you?
And we haven't just met. It's lovely to meet
Yeah,
you again.
absolutely. Good to see you again.
So, Elizabeth just touched on health inequalities, and I
Yeah,
think we're all very familiar with
yeah,
that term. We're here to talk about health inclusivity.
yeah,
So, can I start by asking you, please, to tell us what is it?
yeah. So, health inclusivity is really about, and she touched on it in some of her comments, it's about how do we make sure that no matter who you are, no matter what your economic class is, no matter what your ethnic background is, that you are included in the healthcare system and you have the same access to things. And if you take a big step back and you look, for me, health inclusivity, we need to think about it as an investment in creating stronger societies, stronger economies. It's not a cost thing. If you think about the pressure on healthcare that are happening around the world, obviously the drive for global productivity, I think health inclusivity becomes an imperative and it becomes an enabler. And we partner with the Economist on the Health Inclusivity Index. And what that, tells us many things. One of the things it tells us is actually we could close that gap on healthcare for underserved populations. It has a significant impact on saving lives and saving billions of dollars, which ultimately drives GDP and economic growth. And so for me, it's a much bigger opportunity. And I think also this idea of no one can do it alone. It really does create a collaboration between NGOs and governments and businesses to really come together and figure out how do you go after that.
So, let's be frank, you run a business, a very successful business.
Yeah.
So, I guess that, part of health
Yeah.
inclusivity is having more consumers
Yeah. Yeah.
of your products. But it's also, I know, a lot more than that. So can
Yeah.
you talk to me specifically about the specific areas you're looking at and what?
Yeah, so if you look at Haleon, and maybe just a bit of background, Haleon's a consumer health company. So we've been a listed company for 3 years. We have products like Sensodyne toothpaste and Voltarol and Advil and Centrum. So it's consumer health products. Our purpose as a company is to deliver better everyday health with humanity. That's our purpose. And with that purpose, when before we listed 3 years ago as a company, we set out a social goal around health inclusivity. And our social goal was every year by the year 2025 to empower 50 million people every year to be more included in having opportunities for everyday health. And the way we think about that is we think it about three areas. There's one is just access to healthcare. The other is about health literacy, which is a major issue, and the other is bias and prejudice in the healthcare systems. And all three of those are things that we work on. We also set an ambition to reach 1 billion more consumers by 2030, and we've laid that out publicly. And we are a business, and part of that is business, but a bigger part of that is if you're truly going to deliver that purpose, reaching more people with products that really make a difference for them is what really matters. So maybe to use as an example, because all this is really hard to do. So health literacy. We know that health literacy is a big problem. We also know people with low health literacy, healthcare costs tend to be 3 times that of people with higher health literacy. So if you were to improve health literacy by 25%, that's a 300 billion kind of savings to the healthcare systems, in addition to obviously having a positive impact on so many people's lives. So as we think about that, how do you help solve health literacy? And it is about partnerships. We do quite a bit with healthcare professionals around the world, pharmacists, doctors, dentists, hygienists. We have something called the Haleon Health Portal, where we actually have 1 million registered healthcare professionals, and we provide all kinds of tools on there for people to how do you educate people? How do you help people understand how to treat their pain? How do you be sensitive to different maybe underserved populations and how you deal with that? So there's things that you can do, but we can't do it alone, certainly. The benefit we have as a big consumer health company is you have tremendous relationships with pharmacists and dentists and hygienists and GPs around the world, and it's a platform we can use to help drive that. And maybe to take it even a bit closer to home, here, if you think about oral health, for instance. So, oral disease, which you can talk about as tooth decay or gum disease, impacts about 50% of the world's population. It's completely preventable. Here in the UK, the biggest, for school age children, the biggest thing that, the reason that they go to the hospital is tooth decay. And children in the UK miss 15 million school days a year. Tooth decay.
Yeah.
Tooth decay is super solvable. We've partnered with Tesco here in the UK to create education programs for teachers and try to get into schools to help start with the kids to help them understand what is it about that they need to understand about taking care of their oral health and the implications of not doing that. Adults in the UK, 30 million missed work hours a year linked to tooth decay.
Yeah.
So, and then, again, on the partnership, so this is sometimes you think about those things as emerging market challenges, and it is in India. And we do a lot with mobile dental vans that go around to the rural areas and provide affordable healthcare and oral health checkups and education. But we also do that in the U.S. with Walmart. The issue in the U.S. is as big as it is in India, and I think there's a bit of that. Health inclusivity is not something that is an emerging market challenge or anything. It's everywhere. And the opportunities to go after them are there. It requires partnership and thoughtfulness and a commitment to kind of go do it.
Yeah. Well, thank you for that. So I'm aware we've only got 5 minutes left with Brian. So does anyone have any questions? Anyone like to ask anything? Anyone? No one got a question? Okay, great. More for me. So let me ask you then a bit more about kind of those specific programs, because I think, you're right. I'm a Britain correspondent. I've spent too much time in NHS hospitals and seen some of the impacts they have. But what more beyond, perhaps introducing some of those habits, thinking more about, health literature, as you say, beyond that, what more can be done? What are businesses limited to do? You talked about the role of other partners.
Yeah.
What else, fits into that jigsaw puzzle?
Yeah, I mean, listen, I think it's businesses partnering with other businesses. It's businesses with NGOs. It's governments taking this kind of thing very seriously and looking at it. And if I think about for governments around the world, every government is facing healthcare cost issues. Depending on what country you're in, it's very different. Here in the UK, it's very much the same, right? So, and by the way, being a company that sells over-the-counter medications, the other thing we know is that if people would just use kind of self-treating over-the-counter medications instead of going to the GP, it would save the healthcare system £2 billion a year. So this idea of education does it requires healthcare systems. It requires businesses. And you said something in the beginning that's really important. We are a business, and there can be a lack of trust in business because we have shareholders and we need to do that. The truth is it is good for business. It's good for the world. I mean, it's the things we need to do. We all want a healthy UK. We all want people to have access to healthcare. We all want to be able to, have a better society and a stronger economy. So the objectives are all aligned. So it really does become, how do we unlock this opportunity for partnership and do more together?
Brilliant. Well, I think that's a great place to end on, this idea that we're all in this together. And for me, I guess key takeaway that I'll be taking back is 15 million school days lost by kids to tooth decay. That's kind of crazy. All right, can everyone join me in thanking Brian?
Thank you.
Very much for being here.